Hey everyone, now we are going to do a few asanas for back pain, especially for slip disc. So I'm going to show few asanas with a chair and rest of the asanas on the mat. So let's start with the chair. So if you have lower back pain, doctors will suggest not to bend all the way down. Okay, so we're going to do a few stretches and asanas for lower back pain, half the way down with the help of chair. Okay, so what you need to do, you need to keep your feet shoulder width level apart. I'm going to show from a sideways. Interlock your fingers. Okay, so breathe in, arms up, and breathe out. Both hands on the chair at 90 degrees only. If you have back pain, you can bend 90 degrees. So going all the way down is strictly prohibited. Okay, so we're gonna do it for 5 times. Breathe in, inhale, exhale, look front, 1. Breathe in, breathe out, 2. It's okay if you can't come 90 degrees. If you are here, that's okay. Inhale, exhale, 3. Inhale, exhale, 4. Okay, last time. Breathe in, breathe out, 5. Try to slide your hands forward on the arms of the chair if you can. Look front and try to hold without bending your knees, keeping your knees tight, your back aligned. For 5 deep breaths. 1, 2, 3, 4, and 5. Slowly come up and relax. Okay. If you have back pain, you will feel a little bit pain on the hamstring and glute muscle and lower back area. That's normal. Gradually, when you will increase 5 to 10, 10 to 20, it will decrease. The pain will reduce. Okay. So the next practice is sideways. We're going to do triangle pose. Very easy asanas for the back. It will cover your side part of the back, not the full lower area, but the sideways area. Okay, so very easy. We're going to do again 5 times. One side I'll be showing you can do on the mat. Other side I'll be showing how you can do it on a chair if you have chronic back pain. You can't bend all the way down, so you have option to bend half the way. All right. So breathe in. First of all, we are going down as much as you can, keeping the other arm up. If you can reach your ankle joint, stay. If you can't, you can hold till your knee joint. Okay. So again, breathe in. Now on the chair, place your hand on the chair where we sit and stretch your arm up and tuck your hips out like this. Stay for 2 to 3 counts. 1, 2, 3. Right side or your left side. Breathe in, breathe out. Last time. Try to come all the way down if you can, keeping your other arm active, not loose, like this, tight. Breathe in and breathe out. Okay, so this was triangle pose. First position was half forward fold, and this one is triangle pose. Now, third is cat and cow position with the help of chair. Sitting on the chair, I will be showing 2 variations. First, sitting on the chair. If you work in office and you have sitting job, you can do throughout the day. For these asanas, if your stomach is full, like if there is only 1 hour gap between the food and the practice, it's okay. Other for other practices, we need so like 3 hours gap between food and the practice. But if you have back pain and you want to stretch a little bit, you can stretch even after half an hour or 1 hour after taking your meal. All right, so I'll be showing from sideways. Sit on the chair, your hips back. There should be a little gap between the back of the chair and your hips, okay, your tailbone. So keeping hands on the knees, spine should be erect. So what we're gonna do, we're gonna do inhale. So elbows going to bend, but keeping the hands on the knees. Inhale, Chest open, exhale, round your spine. Very easy and most effective practice for people who have backaches and who can't practice so many asanas, hard asanas. So this is very easy practice. You can get instant relief after doing 5 to 10 times. So basic rule is when we are opening our chest, we have to breathe in. And when we are contracting, exhale, breathe out. 2 more times, breathe in, breathe out. Last time, and relax. Very easy. You can do anytime. Okay. Now the actual variation of cat and cow pose, like how we do cat and cow on the mat. If you can do coming on the kneeling position. Okay. People who have knee pain, they can place pillow under the knee or knee pad, arms in the line with shoulders, gap between the knees. The same we're gonna do. Inhale, look up. Exhale, look down. So there should be movement of your spine. See, my spine is moving. Of course, if you have pain, you have to do slowly. Breathe in, breathe out. Every time you're gonna feel the pain, but gradually this pain will decrease. So we're gonna do it for 5 times, 2 more times. Inhale, exhale. Last time, inhale, exhale, and we can hold. You can count 10 and then exhale down. Again, can count 10 and relax. So if you are going to practice on a mat, the resting position is baby pose. This one. This position is also good for the spine. Or you can keep the hand beside the body and relax. Okay. Now next is downward facing dog, or we can say mountain pose. Um, uh, if you have back pain, of course you have stiff muscles, okay? So it's not easy to do this asana in first attempt. Of course, you need long practice. So that's why I'm going to show two variation. First of all, I'll be doing actual asana and then I'll be showing variation on the chair, okay? So we're gonna come in the down facing dog position from the cat pose. And then slowly lifting the knees and just no need to do final position in the first attempt. You can slightly keep the knees bent and slightly push. Keep your knees bent, push, loose, push. Okay. No need to hold. Just keep doing warm up. Suppose you are not able to do this practice easily and you still have pain. You are not comfortable. What we can do? Chair. With the chair we can do. So what we're gonna do? There should be a good gap between chair and our feet. So at least arms level gap. See, arms level gap. And placing your hands on the chair. Okay. How we're gonna do? Gap, wider gap between the feet. Breathe in, lose the body, and 90 degrees. Okay. And you can push your head down like this. Lose the body, breathe in. When you are losing the body, breathe in. Exhale down and you can push down. If you are not comfortable with this, like you can you can move step your feet back. Okay, breathe in and again breathe out, looking down. If you have cervical pain, don't bend the neck down, just look front. 2 more times. You will be getting the same benefits of doing downward facing dog on the mat doing on the chair. Okay, so don't worry if you can't do on the mat. One last time. Okay, and you can hold as well. Okay. But we need to do dynamic practice because we need a good warm up. Now I'm going to show 2-3 practices in the lying down position, which if you have back pain, you are lying down on your bed, you can do on the bed as well. Okay, so I'm going to remove the chair. You're gonna lie down on the back. Very easy practice. Okay, so bridge pose. We're gonna do first of all bridge pose. Very easy asana, but I can understand if you have chronic back pain, it's not easy to lift the back up. So you can try. If you have pain, skip it for a few days and then try after doing other practices. Okay, but of course we have support of the hands. Hands down, slightly lift the back up and down. We're gonna do it 5 times. Breathe in, breathe out. There is gap between the feet, okay? Inhale, exhale down. Very good practice for the back. Last time, we can hold. So elbows, palms stable, fixed. We can try to lift up. If you have neck pain, don't take pressure on the neck. Use strength of the shoulders. Try to hold. This practice can be done on the bed, but it's it's always better when if you can practice on the mat, okay? Because we need a flat surface. But if you are not able to lie down on the floor, it's okay. Bed is good option. So next practice is straighten your one leg, keep the other knee bent. Very easy practice. We're gonna do stretching of leg, bend and down. This is very easy variation. Slowly. You will feel little bit uncomfort on the lower back. That's okay. If you feel, you can always take support of the hands, pull and down, or maybe you can do pull and slowly with the support of hand down. 2 more times. Last time and down. Okay. Then we're gonna do from the other side. Shake it well. Sorry, we need to bend it to support. If you have pain, bend it. Otherwise, keep it straight. You have two options. Breathe in, breathe out. If you are not able to synchronize your breath with the practice movement, it's okay. For a few days, you can just practice the asanas. Okay. But if you use your full awareness, it's easy to synchronize your breath with the practice. Okay, relax. So this was a warm up. We're gonna do next practice, which is hug the knee, right knee hug, or any knee hug, and straighten the other leg. Hug, very easy. Hug and try to hold and keep the other leg straight, not loose. Straighten, straight, straight. Pull. Okay, change. We can do this 10 to 20 times. Trust me, you're gonna feel relaxed after doing this practice. Little bit relaxation will be there. Okay, the next practice is twisting. Twisting is very good for the spine. So what we're gonna do, interlock the hands under the head, gap between the feet and slowly going to turn. Okay, but make sure your elbows are not lifting. You're not lifting your elbows. Again, this practice, breathe in center. Inhale, exhale sideways. Inhale center. Exhale sideways. And we can hold one side. Look opposite side. This knee, one knee should be touching the floor. Other knee can touch the foot or can be stay like this normally. Other side. Because we have gap, so it's not easy other knee to touch the foot, but you can try to pressurize and try to touch a little bit if you can. And relax. Okay. Now, next and last practice is rolling. You need to hug your knees. If you are able to do it, we have rolling practice. So you need to, no need to interlock. You can just hold, slowly roll like this. It will massage your spine. But if pain is intense, again you can do other variation like this. If you are not able to sit and roll. Okay, so this is a variation of rolling. Now sideways is easy, this one. We're gonna do it for 5 to 10 times. Okay, so if you will do this practice on the floor, you will feel better. All right. So always, if you have to turn, if you have backache and you want to get up, you always should take turn. Slowly come up, sit and relax. Enough for uh, this practice. Just try these stretches. I hope you will feel better. Thank you.